Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, your rheumatologist, and I will be talking to you about a case that I saw today, actually, for a follow up visit. And this case highlights the complexity of polycystic ovarian syndrome, metabolic associated metabolic disorder, and high cholesterol, high inflammation in the blood, and how can we address it. So this case is about a young 28 years old female who has come to me today for follow-up visit, and we discussed about her. um, on the second visit. I usually go over their labs and talk to them about the potential of adding a medication to address their weight loss problem. So this patient presents to us for follow-up today, and I will be talking to you about the complexity of labs that actually have abnormal values in patient with PCOS. She also suffers from chronic fatigue and obesity as a complex disease in her case. This patient faces a wide variety of challenges to help control her hormonal health, as well as helping control her weight. And her overall problem of fatigue also contributes to her weight gain. So this patient has a well-documented history of polycystic ovarian syndrome, chronic fatigue. It has contributed to weight gain. Currently, her weight is 210 pounds and her BMI is 32.5. Her initial labs that I reviewed today fortunately showed that she had normal kidney function, normal liver function, and her blood pressure was excellent, 108 over 76. Her hemoglobin A1C was 4.7, which is also within normal limit. Now let's focus on the problem labs that she had. She had high cholesterol. Her LDL cholesterol was 148. Her total cholesterol was 257. Additionally, she had high inflammatory markers. I always check my patient's C-reactive protein, and it was high. C-reactive protein in this case was 9, which is a pretty high for a young female. And I told her that this is associated with her high metabolic inflammation in the blood is high because of the high cholesterol and insulin um, uh, resistance that we see in patients with PCOS. She also had another problem, which is vitamin D deficiency. It's prevalent in our population, but it's also common to have vitamin D deficiency when you have PCOS and obesity. So we introduced the concept of Zepbound, and Zepbound is the GLP one agonist. It has a dual peptide, so it works on two pathways: the GIP, the gastric inhibitory peptide, and glucagon-like peptide, and it's one of the most effective medication currently available for weight loss treatment. So I'm going to suggest that she starts on it now. Uh, I checked to make sure that she does not have history of multiple endocrine neoplasia. She does not have a family history of multiple endocrine neoplasia or personal or family history of medullary thyroid cancer. Um, I want to also highlight that in the course of patients who have I treated in the past with PCOS, their hormonal status improve with change of their metabolic resistance, insulin resistant and metabolic syndrome. So this medication not only help them lose weight, but also help balance their hormonal issues. As a matter of fact, a lot of my patients who have struggled with fertility issues because of PCOS, when their weight is reduced, their insulin resistance is reduced, their hormonal levels improve, and they are able to conceive as well. Of course, you should be working closely with your doctors when you are dealing with any of these issues because of the complexity of this nature. So the glucagon like peptide GLP medications, you have to make sure that while you're trying to achieve weight that you are using contraception, but once you achieve the ideal weight you should stop the medication up to 3 months, between 1 to 4 weeks to 3 months or 12 weeks, and then try to conceive. But I wanted to highlight that managing a PCOS patient with chronic fatigue and metabolic syndrome is something that It's very common, unfortunately, but it can be easily addressed with an experienced physician who is board certified, who has dealt with these type of problems. And I will also go along with to say that nutritional deficiencies, which are quite common and undiagnosed, should also be addressed. So with that, I would like to say thank you for watching this video. Please share it with someone who may be suffering from polycystic ovarian syndrome, vitamin D deficiency, obesity, chronic fatigue. See if they can work with a physician to help find a solution for their better health. And working with a healthcare provider experience in these fields would be extremely helpful for you. And until our next video that I meet you, please take care of your health and stay active.